One of the biggest projects that we're currently working on is on biologic specialty pharmacy. These are a very unique set of drugs that are specifically for people, smaller percentages of people that have MS, hemophilia. A lot of your oncology and cancer drugs are biologic specialty pharmacy, and the reality is that they can be very, very expensive. In fact, we've done research with our employer members and have identified that their knowledge of this entire area is far less than what we expected. They need to have a better understanding and awareness of what it is and how they can better manage it in the future. In fact, we did an employer survey in 2011 and found that almost 78% of all employers across the country that participated in this survey have no to moderate understanding of what biologic specialty pharmacy is. So one of our goals is to do 3 things to help get them up to speed, because one of the things that we know that in the next 8 to 10 years, or even less than that, biologic specialty drugs are going to represent about 40% of the medical spend. And that is a significant investment that employers are going to have to make. We need to help them prepare for that. So what we're going to do is create an employer toolkit that's going to focus in 3 key areas: the understanding and awareness of what it is, so that they can better articulate that to their senior leadership and their employees. We also want to focus in a section on unique or appropriate benefit plan designs. Right now, most employers are using traditional pharmacy benefits for specialty biologics. They really need to look at that and implement strategies that are much more effective. Incentives are a very important part of that. Medication adherence and treatment compliance are critical. So another section will focus on that. There's a lot of PBMs and health plans and specialty pharmacies in this space that serve as the vendors that support employers. But we've discovered that employers are relying on them to tell them what the benefit plan design should be, to tell them what the contract should look like. We want to have it be more transparent so that that employer is empowered with the right knowledge, the right information, and the right contract language so that they're selecting the right vendors and that they can ensure that that vendor is best managing their at-risk patients. And then finally, we also are going to include information on communication so that employers can more effectively communicate what this is to the consumer, to their employees and family members. The next several months, we're going to be doing educational programs across the country with some of our sister coalitions, and there are a number of other work streams that we're looking towards doing in the future. I'm happy to share the additional information with you down the road. Thanks.